All right, so are we ready? Okay, hello everyone. From you know, as I always say, friends old and new, and of course, Dr. Jake Bowers, that's our new today. It's really our privilege to have him here. And let me just to introduce this colloquium just a little bit. This is data analytic colloquium that Carl and I set up and initiate this colloquium as an online webinar. It's supported by the National Chongqing University in Taiwan and the UTD, EPPS, where Dr. Carl Ho is working at. And this is about a what we call it the convenes international scholars, well-known scholars, and then the data scientists and online seminar. This is what we're doing here, and this is our second season, we can call that, because usually we use the second half of the year. So the previous year we have many guests here. So welcome to check our website, Data Analytics Colloquium, and you can all see the previous speech online, and then you will be impressed by all the guests that we have invited, including today's the guests. So I want to welcome you all, and I hope that you can enjoy this speech today. And welcome, and please do check back. And looking forward to next speech here. But for now, I have to turn the microphone to Dr. Carl Ho and to give introduction and to Professor Jake Bowers. Thank you.
Hello, thank you, Professor Pan. It is really a privilege to have Professor Jake Bowers to come to our colloquium. And allow me to take some time to introduce Dr. Bowers. And he's the award-winning writer, and he is currently the methods director at the Evidence in Governance and Politics Network. He's also a professor at University of Illinois at Urbana-Champaign. And Dr. Bowers has been working on projects crossing social and behavioral sciences and public policy. And he is a fellow of the Center for Advanced Studies in Social and Behavioral Sciences, and also the Causal Inference for Social Impact Lab. And Dr. Bowers is also well known for his research for Impact, an organization that aims to connect researchers and practitioners in the interest of improving public policy and governance and advocacy. And over the years, he works with another famous methodologist, Wendy Tam Cho, and to have the methodology speaker series in University of Illinois. And I think if you check his name, and you should not miss his award-winning articles in political analysis. And he is very active in research and also well-cited political methodologist. And today we are really privileged to have him to come to talk on the topic how government can help promote vaccination. And without further ado, let me introduce Professor Bowers.
Carl, thank you so much. That was really too kind of you. I really am so grateful to be able to be here and to share my work with you guys. Yes. And get some of your feedback. And also maybe show some of what's possible when academic political scientists can collaborate with people in government. So since this is a COVID webinar, I always have to ask, can you see my screen? Does it work okay? Excellent.
Yes.
Wonderful. Yes,
great.
And does it change?
Yeah, that's
okay, great. Thanks a lot, Peter. Great, perfect. So today, what I'm a person of too many affiliations because as somebody who studied a lot about data science and political methodology, I've had the opportunity to get involved in a lot of fun projects. It's certainly been a way for me to really have a lot of to feel like I'm having an impact in the world, and to meet a lot of great people and to be involved in really exciting research. And what I wanted to do today is, since this is a methods kind of a colloquium, I wanted to show you a couple of projects in which we we kind of mobilized a few methodological innovations in the interest of helping the government of Rhode Island, in this particular case, answer this question about vaccination. So I have two different projects, and both of these projects you'll see are only possible via a lot of collaboration. So the big question that we began with was, how can we increase vaccinations? In the middle of last year, we began to have meetings. I am still a fellow of a group called the Policy Lab at Brown University, which is a group of people who work to do studies that are driven by the government, but also that we try to publish in peer-reviewed outlets. And I've run into a report here about two studies that we did. One, a randomized study with a very large sample size, where we randomly assigned people to messages. The question was, what messages could we send people cheaply via text messages in order to mobilize them to get to vaccinate? The other study is not randomized. It's a series of surveys in which we try to learn more about why people might not be vaccinated. And the methodological innovations there are that we use something called non-bipartite matching and sensitivity analysis. Now, we didn't invent any of the methods that I'm presenting, but we're using methods that are not common in public policy, and maybe they might be new to you, or maybe they're common to you, and you might have questions or be interested in seeing how they're being mobilized here. So I have two of these studies that I'm going to present, basically show you about them. Feel free to ask questions at any time. And then we can dig into the methods more later, or talk about how academics can be involved with governments and non-academic actors to help make the world a better place using statistics, because that's been what I've been up to, and it's been really fun. Okay, so and frankly, it's been surprising to me that somebody who loves to write R code and loves to nerd out on statistics can be involved in making the world a better place. I thought it would be mostly my friends who are good at giving speeches or writing party platforms or something, but actually there's power in the nerdiness of what we're talking about here. At least that's what I've found. Okay, so how do we reach the people who are not yet vaccinated? Let me give you, this is a paper that, again, has many, many different collaborators involved. It was organized through the Policy Lab at Brown University, but we've had people from Boston University, et cetera, involved as well. Okay, so here's the situation. RIDO, which stands for Rhode Island Department of Health, keeps a list of people who have not yet had a COVID vaccination. And as of May 2021, they had about 160,000 people who've had a test but no vaccination. So the question was, RIDO came to us and said, you're social scientists, you know about behavior, how can we help people be vaccinated? Now, we suggested, there's previous studies suggest that simple text and reminders can help a little. So even if you can move the needle by 5 percentage points, that's millions of people, or in this case, not millions, but tens of thousands of people being vaccinated. However, we've also seen some other studies that suggest that messages don't really work, or they decline in effectiveness over time. But no study reported that people, had negative reactions. So we figured we'd pursue this idea. As of April 12th, 19th, everybody in Rhode Island, all adults, were eligible to be vaccinated. But as of about a month later, more than 140,000 had not been vaccinated. Actually, 160,000 is what I should be saying. The Department of Public Health in Rhode Island sent people off into neighborhoods to ask questions and do qualitative interviews. Why are you not being vaccinated? Why do you trust the government? Do you not trust the government? And then we had a meeting with the qualitative interview, the ethnographers, and we suggested, well, why don't we come up with some messages based on both the behavioral science literature and these discussions, and we will test out messages, because they didn't have a lot of money. They thought the question was, what can they do with the very little bit of money? A key piece for us was that we would create these 8 different messages. We'd build them all based on a previous study that had a strongly positive effect by Dye in 2021 in UCLA. By the way, you'll see this as an interesting example of how fast science can accumulate when people share their data and their findings. and that we would make it into an adaptive experiment. So we won't go through all of these because this would be that these are all the different messages that we tried out. They all began with a Rhode Island a COVID vaccine is available for you. Click here for all the ways to claim your dose. So we emphasized ownership of the vaccine. That's what worked in the UCLA study. 2 months before we did this. Peter, are you talking? No, I guess. Are you trying to ask a question to us, Peter? No, maybe he's talking to the students. Okay. So, and then we added all these different other kind of prompts on top of the collaboration.
Let me see. Let me put this back to. Yeah, back now.
Okay, is that all good?
Spotlighting, yeah.
Okay,
good.
Totally fine. I just want to make sure that I wasn't missing a question. Okay.
No.
So here's the evaluation design. The outcome was to find the best message. We had all these people not known to be vaccinated, and then we decided to randomly assign them to essentially three waves of an experiment. We randomly assigned day of the week as well within the week, and one of these 9 conditions. And we changed the probabilities of assignment each time. And I'm going to talk about that, I think, on the next slide. But the idea here, let me presage the idea. The idea is that if we have these messages, these 8 messages plus no message, in the end, if all we wanted to do was to find the best message, we should assign the same proportion to every single message. But if we also want the most people to be vaccinated, we would like more people to be in the most effective message. This is a common approach used by Facebook and Google and other online market merchants to sort of try to earn as much money while learning as much as they can. We only use 3 waves instead of millions of waves, and we tried to figure out, but in the end, we wanted to vaccinate as many people. We had a policy goal as well as a scientific goal, and we're trying to balance the 2 things. So we began by randomly assigning everyone with equal probability to all these arms, and then our plan and what we ended up doing was to take the arms that had the best performance after the first week and to put more people into those arms at random. So no systematically, not, so it's still a randomized experiment, but just not a randomized experiment with fixed probabilities. The reason why we go between this number and this number is that the study ended 1 day early. And we had allocated a lot of our sample to the last week, okay? And we can talk a little bit about why the study, the reason the study ended 1 day early was that there were people complaining about getting too many messages. Now, we only sent 1 message per person, but there were many people who received lots of messages. This was a period of time where lots of actors were saying, be vaccinated, okay? Now, here's the adaptive randomization, which I thought might be interesting to you all. So we begin with, imagine we have 2 messages, I and J. We begin by having the same probability for all treatment arms. So in this case, it would be 50-50, or, in our case, it was like 1/9. Okay. Now, the second week, we do 2 things. First, we keep 25% of the people in this kind of situation. Okay. So you're getting a fixed number in every single arm. Okay. But the other part, we increase probability of assignments to arms with more vaccinations and decrease assignment to arms with fewer vaccinations by the end of week 1. Okay, so it's kind of like we begin to have 2 experiments. One where everybody gets assigned at, with 1/9 probability each arm, but then there's another one where your probabilities are higher. In arm 6, which seemed to perform well, we increased the probability. We divided it this way because we weren't certain that we were making a good bet. We knew that this was a noisy process, and so we figured that this would be our insurance. We would always maintain an experiment, in essence, a simple experiment at each time point, even while we made bets in this experiment to increase the probability of people being vaccinated. Okay, so in on online merchants, what they do is they don't do this part because all they want is more money, basically, plus learning, plus a little bit of learning, and so they're willing to make bets here. But we're in the policy world, and so we really were worried about if just by chance one of the arms popped up as really powerful, if we bet it all on that arm, we might be really decreasing our statistical power and also preventing people from being vaccinated. For more on this is a really nice blog post. I shared the, and I can reshare this PDF file with some of these links if you'd like to see them. Now, here are the results. The results are nothing. This is a null results experiment. First of all, you can see that this is all differences versus the no message condition. And this is the 0 line, and these are all 95% confidence intervals. You can see we can't detect any effects. None of them are different from 0. More importantly, I like to interpret the ends of confidence intervals sometimes, but even the ends of the confidence intervals, we're talking about, 0.4%. It's very, very tiny changes. So we see a null result. This is the effect of getting vaccinated by the end of the period of 1 month, and this is the effect of being vaccinated within a 1 week period after we sent you the message. Okay. Now how to interpret this? Well, it's an interesting question. Previous studies had targeted the beginning of policy rollout. In particular, this COVID study occurred within 1 day to 8 days after the people were eligible. Okay. On top of it, this DIE study, the average age was 70. These were elderly people who were part of the UCLA health plan. Our average age was 35, and they were not necessarily covered by any healthcare plan, and they had already delayed in getting hadn't raced to be vaccinated. Why is it the case that we have this null result given the somewhat positive results in some previous studies? We don't know. We have some hypotheses, and that we're going to be trying to work on them in the future. It may be that, there's novelty in receiving a message if you receive it immediately, okay? Or maybe there's floor effects. Maybe there's only a certain number of people who might be motivated by a simple text message, whereas other people must be motivated by stronger kinds of behavioral incentives. So what we learned in this particular case was that SMS messages didn't hurt but didn't help. We think it was because it was too late in the COVID vaccine rollout. Most of the message susceptible people had already vaccinated, but we're not certain. Policy consequences were don't send text messages to people who haven't been vaccinated after about 4 weeks or something like this. Like the vaccine hesitant aren't not going to be changed by a text message. This is our idea. However, we might suggest that the government send SMS messages immediately as new booster shots become available, or for child vaccinations, or for new populations, or when new populations become eligible, as a way to speed take-up. We've also shown that while we can do rapid evaluations in combinations with policymakers, as I say here, policymakers are eager to learn broadly. That would be the experiment where we randomize to all 8 possible treatments, but they want to vaccinate. I mean, their job is to protect the public health of people, and they'd like to learn while doing it, but they're often, in the COVID case, running as fast as they can to implement rather than learn. So we were able to combine learning with implementing in this particular case. This paper is under revise and resubmit right now, so we're happy that, and we actually were able to give a talk right next to DIE, and we were able to have a really good conversation about how fast we can all learn about this process. Okay, so that's the first study. I'd be happy to. I could take questions now, or I could move on to the second study. Either is okay with me.
Do we have any questions from the Taiwan side or US side? And you want to move on to another study first, and then we'll have more questions later?
For sure.
Yeah, how about that?
Sure. Let me move past my extra slides. Okay. All right. So then the second study that we did had to do with where vaccine acceptance or resistance comes from. And we wondered whether it could be descriptive social norms. This is a paper with these co-authors from the Policy Lab. So, David Glick and I are both fellows with the Policy Lab, even though we are formally professors of political science at 2 different other universities. So our previous study was in some senses depressing. We began with a governmental agency saying, hey, social scientists, help us vaccinate. And we said, well, here's one idea that might be promising, but it doesn't work. And we showed pretty strongly that it doesn't work on this group of people in this particular time. So the question was, what can we do with people who are vaccine hesitant? What can we do? And we realized that there's a pretty big body of work, and I just do this to kind of like indicate there's a large body of work that suggests that social norms matter. That see, if you understand what somebody else is doing who's relevant to you, say your family or your friends, that's going to matter to you in terms of how you make your own evaluations. We're not 100% certain exactly how descriptive norms work. Maybe it signals costs or benefits. You learn about costs and benefits from people who you think have similar kinds of utility functions to you, or maybe there's something else. You're worried about sanctions, or you gain benefits. But regardless of the mechanism, we've figured out that having a reference group, what your reference group's does might matter. And we had happened to be pursuing this for some other reasons, in part because of some work that Kara Wong, who's also here at University of Illinois, has done by varying the size of your reference group. So we asked people about your family and friends, your neighborhood, your city and town, your state, and also we asked them about other Democrats and Republicans. In fact, we asked also for out groups as well. We asked whether or not people are going to be vaccinated. So this is a survey experiment. It's not an experiment at all, actually. It's just a series of surveys. So we asked people, how many people in your family and friends network do you believe will definitely get vaccinated, right? In your neighborhood, your city or town, your state. How many Republicans, Democrats, or independents do you believe will definitely get vaccinated? These are all Americans, American residents, focusing on Rhode Islanders, but also including non-Rhode Island, like random samples of the United States. We then asked if and when a coronavirus vaccine becomes available, will you get vaccinated? This was before vaccinations were widely available. And we also then asked, right when they became available 1 month later from Rhode Island's perspective, whether you definitely will or have you already become vaccinated. Okay, and the question was, well, we were wondering if the people who perceived that others were getting vaccinated would also intend to be vaccinated. Now, here's the methods challenge that comes up here. Obviously, we're interested in this relationship between perceptions of others and own intentions, but we know that, for example, age is a confounder, right? So older people may both intend to be vaccinated and be surrounded by other older people who tend to be vaccinated. So if we just, compared the mean intention among those who, this should be 1, this should be 0, sorry about that. I can do that because I have my handy dandy pen. If I just compared the mean of people's intentions among those who perceived that many others were going to be vaccinated, compared to the mean of their own intentions among people who perceived that nobody would be vaccinated, that would not necessarily give us this kind of true underlying causal relationship, because it would be confounded by age, right? So this is identical. The coefficient on some linear model which is the same, which would be very similar to this, would not give us this either. Okay. Now, what about if we controlled for things in the context of a linear model? Would that give us a good estimate of tau? Well, the dilemma is that it's very hard to communicate to a policymaker whether age plus gender removes their effects, right? I mean, why not add age squared or age cubed times gender, or dummy variables for age and gender, etc. There's so many possible ways to control for that's really hard to go to the governor and say we've really removed the effects of age and gender and party, let alone trust in government and religiosity, etc. It becomes a huge mess to try to use a linear regression model to adjust away these potential confounds. Now, if we could randomize perceptions, that would be great, because randomizing perceptions would end up breaking all of these pathways into perceptions and therefore unbias these estimators here. The dilemma is you can't really randomize people's perceptions of what their family are doing. That's like lying to them. I mean, if I could say, hey, everybody in your family is going to be vaccinated to some people, and nobody in your family is going to be vaccinated to other people. But many people would say, you just lied to me. So now my treatment is lying by the government. So that doesn't work. So, we really want an observational study here. We don't really want a randomized experiment to study perceptions, unless we're very, very clever. But we weren't that clever. We just happened to measure perceptions. So the idea would be here, our idea was to hold constant by stratification, okay? So the idea would be to take two people, if we took two people who were both men, right, now, and I compared what the vaccination intention of the man who perceives that their family and friends are going to be vaccinated versus the man who perceives their family and friends are not going to be vaccinated. Now, man is no longer a confounder. Right? Now, there may be other confounders. Maybe I need to do both Republicans and men. Maybe I need to do Republican men who are the similar age, etc. Right? So we need to do something. Once you begin to do stratification for control, it's easy to communicate. It's transparent, and I'm going to show you in a second how we evaluate it. But there's a new rabbit hole that you go down. Now, how do we do it? It turns out this is pseudocode, but this is roughly what we did. So we make a distance matrix of a bunch of different variables. So show how different is everybody from each other in terms of many, many aspects from the survey. We make another object that basically records how different people are in their perceptions of their family and friends, for example. And we also make another object saying, I don't want you to compare people who differ by more than 9 years or by more than 2.5 points on the ideology scale or by 1 point on the education scale. I also say you need to make sure to only match men to men and women to women and non-binary to non-binary, Democrats, Republicans, Independents to each other exactly. This is survey wave, and this is US 5 categories of race. Then I use this command here.
Hey Jake, sorry to interrupt. So you're using this design match package in R and uses matching functions.
Yep.
Yeah.
Exactly.
Okay. Yeah. Perfect. I think I want to interpret to the audience who may not be familiar with this design match package. But it's a very cool package.
Yeah, it's a cool package. Happy to talk. There's some details that it can run fast or it can run slow. By default, it runs pretty darn slow. My students are using it right now, and they say, "Oh, my computer ran all night." But the cool thing is that the more well-established package that the Paul Rosenbaum's book on matchings uses is called the OptMatch package, and it runs very well, but it uses bipartite matching. You have a treated group and a control group. Here, we don't have treated and controls. We just have people who perceive on a 5-point scale, right? So I really want to take everyone, a square matrix,
yes,
right? And create maximally similar pairs. And then within the pair, I can say two people who differ by this many points of perceptions also differ by this many points of intention. So it's kind of matching on a continuous treatment in some senses, right? So that's why it's a more computationally complicated. But yeah, this is my favorite non-bipartite matching command right now. And I highly recommend a lot of work by Jose Zubizarreta. He does some really cool stuff.
Okay.
Like the effect of the Chilean earthquake on people's mental health, etc. Really cool stuff. Okay, but I made this slide in part to show that it's not overly complicated. Like my code has more than this in it, but really, it's really you represent differences between people. I'm using a Mahalanobis distance. And then these three pieces here just exist to tell this command, only exactly match Democrats to Democrats, and please don't match from more than this many years of age. Exactly. And since I want to compare two people, and I want to say the person who perceives more vaccination in their family should be the person who also, or my theoretical hypothesis, is the person who intends to vaccinate more. If they're the same, they don't help me. Then they have the same perception, so I can't make the comparison. So, right. So I'm making all these pairs. I'm boiling the data down like this. Now, the nice thing about it is that so first of all, I can say to a policymaker, imagine two Republican men. And then I'll show you that the Republican man who thinks that more of their family are getting vaccinated is more likely to be vaccinated. That's a very clear way to talk about adjustment. Obviously, you can do more statistically powerful adjustment with weighting and different functional forms, but from the perspective of communication to policymakers, it's very powerful, right? You're not saying, just trust me, I'm being fancy. And you're certainly not talking down to them, right? And saying like, oh, you wouldn't understand a doubly robust, estimator or whatever. You're saying, no, I want to help you. You're the decision maker. I'm not going to send the National Guard out to record vaccination tests or whatever, right? The other nice thing about this is that once you've organized your data in pairs, you can say, well, I have pairs. What would be a good design in a pair? Well, a good design in a pair would be a good design where we randomize perceptions within pair. Like imagine we could do that. We know what that would look like. We know exactly what the difference of means between the high perceiver and the low perceiver would be like if it were randomized, right? We would imagine this is like the standardized difference between like the average age of the high perceiver and the average age, a high perceiver versus the low perceiver would be basically 0, right? And the education would be basically, these are the differences of means, right? And these are scales, trust in science. And one thing we can see is essentially that they're all 0, okay, after matching. Now, we did, these are kind of like t-tests. These are a bunch of t-tests. But now, we don't really want to do that many t-tests because we have to adjust for, we'd be making false positive errors. So we did two different ways to work around this. One is this is a home adjustment, like a Bonferroni adjustment. Alternatively, we can do a test that is across all the covariates. This is something that my friend Ben Hansen and I worked on, which is that you can do a multivariate test. You can test the hypothesis of no relationship across all the covariates at once. So you can do one test rather than 10 or 20. Okay. And this tells us that this design, the first design after, going from about, 2,000 people down to about 1,000 people, this design compares very favorably with an experiment. We can't distinguish it from what an experiment would be like on these variables here. So we have a standard of comparison. So again, the policymaker could say, is this a good design? We could say, well, if an experiment's a good design, then this is a good design. Now, bear in mind, it's not an experiment because we're not balancing any unobserved confounders. But on these confounders, we're doing a good job of controlling them. What is it? We can claim that we've controlled enough. And it wouldn't be surprising to you to see that we were able to achieve the same kind of result for the second study as well. So similar across all covariates. When we compare this design to a randomized design, we get our p of 0.9. So really, there's no argument against the idea that this is that it looks like an experiment could look like. All right. So now let's get to the results. So finally, we don't have a null result. So we were very happy to see this. What we're seeing here is that conditional on pair. For those of you who've studied fixed effects, this is essentially like regressing own vaccination intention on perceptions with fixed effects for all these pairs. So, 500 pairs. These are the results. So in study 1, we see extremely positive effects that kind of go nicely downward the farther away the reference group is from you. On study 2, we get a very similar kind of a result, okay? And what's particularly interesting here, which we don't quite know the answer to, again, both of these studies have me saying, I don't know why for part of them. When we asked Democrats, so within pairs of Democrats, we said, does the person who perceives that more of Democrats is being vaccinated, are they more likely to be vaccinated? And the answer is no. Doesn't matter. But in pairs of Republicans, the Republican who thinks that other Republicans are getting vaccinated is more likely to be vaccinated. Now, these are broad because we had to cut the sample down, right? But it's still quite interesting that we have this distinction, and I don't really know the answer for it. The outgroups make a little bit more sense. Perceptions of Democrats getting vaccinated were irrelevant among Republicans. Similarly, between two Democrats, the one who thinks that more Republicans are being vaccinated is no more likely to be vaccinated than the other one. Okay, and again, these are all within pairs that are the same in terms of party, gender, race survey, and then balance on age and all these other sorts of things. Now, the last point here is that, so we took care of party, gender, age, etc. We took care of all of these things by holding them constant, and that's what I sort of tried to show. But what about unobserved confounders? We didn't, if we were able to randomize, we would not have unobserved confounders. This is a 20-minute online survey, right? The question is, our strongest result is a very, very strong result. It's a result that's very easy to, distinguish from zero. If there were something out there that's lingering that could explain this away, how big would it need to be? Now, we know there are things lingering out there because it's an observational study. It's not a randomized study. So it's fine. We don't want to claim that we have an entirely unbiased study, but what we do have is a study. The question is how big of a lingering unobserved variable would we have to have? So here's one way to think about it. One way to think about it is to imagine we have some unobserved confounder, and it could either predict perceptions. It could make you be like the higher perceiver, like the process of perceiving more members of your family being vaccinated could be driven by this unobserved thing. We're claiming it's not driven by party, gender, or age within pair, or the other variables. And it could also drive intentions. This is back from your omitted variable bias, lectures, right? An omitted variable bias occurs when you have this kind of when you have these two things being large enough. So what might it mean? Imagine that there's some U that if you regressed, are you the higher perceiver within pair using a logit model? You'd get a kind of a difference in log odds that would be large. So in our case, we did a sensitivity analysis using this approach from Rosenbaum and Silber that led us to a 5 here and a 19 here. So what does that mean? It means that this U would have to increase the odds of being the higher perceiver by 5 within pairs that we've made. It has to be a U that's independent of party, gender, age, race, etc. And it has to increase the odds of perceiving those around you as being likely to vaccinate by 5, and it has to increase your own intentions by 19 in order to move your p-value from that to erase our result. So then we asked ourselves, well, what could it be? We didn't come up with anything that would be so powerful. that was independent of everything else that we had. But this is in the hands of reviewers, and I'm sure that the reviewers are going to come back with us and tell us what they think might be these kinds of things. We did this sensitivity analysis for all of our different input variables, family, neighborhood, city, state, Democrat, Republican, etc. And even the weakest relationships would need an unobserved covariate to more than double your odds of being the higher perceiver within pair, and more than triple your odds of being the vaccinator within pair. So that's why we sort of felt like we were pretty strong in terms of going forward with this survey data analysis and talking about causal relationships. All right, so we were able to provide some evidence that adds to the big body of evidence that perceiving how you perceive others to act bears on your own behavior, and there's definitely some policy implications. So for me, among Republicans, Republican in-group matters. And also more intimate and local groups seem to matter more than broader and more diffuse groups. For example, it's not clear to us that having famous Republicans be vaccinated is the key here. Maybe what we really need is to have members of families, to sort of who differ from one another to say, hey, I'm vaccinated, or in any family that in which people are not being vaccinated around them, regardless of the partisanship, right? So we don't know what our next steps are. We're generating ideas for a randomized field experiment, to try to use some of these ideas and see if they hold up in the field. But we don't know what they are yet, and I'd love to hear more. So what have I shown? I showed a null result and a positive result. They're both submitted for publication. The large SMS RCT showed us that we could try to simultaneously try to vaccinate as many people and also learn using this adaptive experiment. I guess, a subtext is also that you can try to publish a null result when it matters. We also did an observational study that's not randomized at all, but where we created a research design through sort of clever stratification and through doing due diligence with sensitivity analysis to kind of, we hope, provide a warrant to do the field experiments coming next. So that's kind of, I think that's it. I have more ways to be involved in this work here, but we can talk about that later. Thanks very much.
Great, right on. And now I think there should be some more questions from the audience, from students, and also from us too. So I think how do I start? Maybe I can make it a more educational piece and to invite you to talk more about matching, the idea about matching, and that is underlying the design. Is very sophisticated design, and some results warrant a little bit more discussion down the road. Can you give a quick crash course to us on matching, and also what motivated your design? Yeah.
So right. So absolutely. So I think that when it comes to matching. Oh yeah, good. I'm unmuted. So when I'm trying to think about what to draw about, but I'll talk for a second. So, well, maybe I can draw for a second. So, when we think about, some kind of relationship that we're trying to learn about, very often we're concerned about all these different, possible confounders. These are other variables that matter here, okay? And in my case, it was, this was perceptions, and this was intentions, and then we had age, gender, party, et cetera, right? And we know, we can tell so many stories about why this piece here is not going to be interpreted correctly if we just compare intentions among people who have high or low perceptions, or alternatively, if we just regress intentions on perceptions. There's a million alternative explanations. So how do we engage with those alternative explanations, right? I mean, one idea is to have multiple studies, which I think is actually a very powerful idea, right? Here, what we were doing was working kind of within the context of one series of studies. Now, what would be a way, what is a design that does do what we want it to do, which is to get rid of these alternative explanations? Well, an experiment does. Why does an experiment? If we randomized, I'll make it orange, what if we randomized perceptions or some input? What does that do? That breaks these relationships here. It doesn't touch. Age is still going to predict whether or not you want to be vaccinated. But age can no longer be related to who has higher perceptions or not, because I've randomly assigned them to you, right? Let's say I randomly assign badges, or I do, perceptions is an interesting one, but let's imagine, a randomized experiment does break these relationships that we're worried about. All right. So we have a design that does break the relationships that we're interested in. What's a similar design to that? Well, how do we break relationships? We have two big approaches. The simplest and oldest way is to compare people who are similar. So again, as I said before, if we take two people who are both male, now male is not a confounder. They're all male, right? So, and all the women they're all women. You can't claim to me that men is doing the explanatory power, because it's literally the same. And so you have these strata within which you estimate results, and then you combine them by weighting them. Okay. So great, that works great. That raises all sorts of other questions, right? Like how the heck do you combine more than one variable? Like, okay, fine, that works on gender, but what if you have 20 variables? How would you do this work with 20 variables? And that's what I was kind of suggesting, which is like, well, look, let's say I want to combine people on two variables, X1 and X2. Well, I can take two people who have different values on X1 and X2 and just calculate the differences between them in the X1 to X2 plane. Right? So that's what the Mahalanobis distance is doing. It's converting, right? It's converting a two-dimensional space into a one-dimensional space, right? So here's, here's distance, here's like person A, B, and C. Here's distance between A to B, and here's distance B to C, and here's distance C to A. Right? And so now we have one number again, and I can compare people. So Mahalanobis distance is a way of doing dimension reduction, and that allows us to go back to our stratification. Now we have another burden, which is, okay, you stratified a Mahalanobis distance. I don't even know what to make of that. I know what it means when you compare men to men, which is why then we said, okay, well, why don't we compare differences in age, in gender, in party, between people who are in one group versus the other group, even if we made the groupings based on Mahalanobis distance. We make it on Mahalanobis distance, but evaluate it on the raw variables. Okay, so that's kind of a workflow that we can use. Now, it is very, very common, like the elephant in the room is, and maybe many of your students are saying, well, wait a second, that takes a ton of work. I know how to control for things. In R, I just do this. Age plus gender plus party. Done. Right? Or in Stata, it's like reg, what is it? Y, Z, X, blah, 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 blah.
Yeah.
That's controlling for. So if somebody says, did you control for age? You can say, oh, yes, I controlled for age plus H. Done. Right? But that leads you down another set of questions, like, did you control for age enough? Well, what do you mean enough? Well, I mean, is it just age? Could age be non-linearly related to Z and to Y? Could age be non-linearly related to gender and party? Like, what's your evidence? Like, can you tell me that you've done a good job of the controlling for? Ooh, we're back to Aiken's rule of three, right? Like, the part of the Aiken's rule of three is that it's so hard to convince people that you've done a good job. Like, how many plots do you have to do to figure this out, right? Right, because in essence, one of the things that we talk about, I hope it's okay, I'm using R language here instead of stata, but it's similar enough. So, in order to get this coefficient here, right, let's say I have, y equals beta 0 plus beta 1, z plus beta 3, x1 plus beta 4, x4. In order to estimate this coefficient, remember what we have to do. Like, a way to get this coefficient, or what another way to do multiple regression, right, is we do equation 1 is we do z equals gamma 0 plus gamma 1 x1 plus gamma 2 x4, and then we do equation 2 y equals lambda 0 plus lambda 1 x1 plus lambda 2 x2, sorry, not x4. I don't know why I put 4 down there. And then if I fit all of these things with least squares, and then I regressed, y hat on, beta 0 star plus beta 1 star times z hat, these two things are identical. Right? So multiple regression is in essence like regressing the residuals. This is not actually, sorry, it should be z minus z star, y minus, this is what comes from like doing everything, thinking it'd be fun to do all this on the fly. So z star, y star, and this is y star, z star. So this is the residuals. This is like z, this is z without, it's the linear relationship with x1 and x2. This is y without the linear relationship with x1 and x2. Regress these residuals on these residuals, you're going to get literally this coefficient. So what is linear controlling for? Controlling, it means removing linear additive relationships, which is great. I mean, it does a very good job of it. It's very precise also. It's like the best way to remove a linear additive relationship. However, if the relationship isn't linear and additive, then you're removing the linear and additive part of the relationship. And that doesn't, it's hard to communicate about that with people who say, I just want you to remove the relationship, not the linear additive part. I don't want age to be part of the story here because I can't afford that. So that's why the stratification-based approach becomes attractive, because it's so non-parametric, right? Yeah. And you don't have to justify why you believe that this is the right functional form. So I sort of like justified matching and compared it to, or I'm calling it stratification because that's basically what it is. And then I'm comparing it to what you might call covariance adjustment, which is this, removing linear additive, removing a functional form, basically, because you could make a better functional form, for sure. Right?
It's basically your 2008 paper, and with Hansen, and talk about that stratified and cluster, and try to make it into dead pairs for comparison, but you stratify them, particularly for age-like continuous variables.
Yeah, exactly. And so then what we did. Well, thank you. But what we did there, the whole idea there was, okay, well, how do you know you've stratified well enough, right? And what people were doing was saying, well, let's look at a t-test on age, gender, party, and they'd have these tables with like 50 t-tests, but we know that that's going to lead you astray. You're going to find one t-test with a small p-value and go, oh man, it's a bad design. But if you actually randomized, 1 in 20 variables are going to have small p-values. It's just a nature, right? Right. And so we wanted to kind of communicate that and say, look, if your standard is the experiment, then realize what experiments really give you. They give you like 1 in 20 imbalance. Right. And so that's what the omnibus, the omnibus test is supposed to do there. Yeah, and it's a ton of work, I have to say. It's so easy. I spent so much time looking for good matches. I just did an experiment, did a study where we're looking at the effect of selling marijuana. So pharmacies in Uruguay became allowed to sell marijuana in 2017, and 16 pharmacies decided to sell marijuana, and we got surveys done on the ground in those neighborhoods, 10 people near every marijuana selling pharmacy right before they sold marijuana. And then we got 60 pharmacies that didn't sell marijuana. And we want to know about the effect of a legal change on the social norms of the place. So you change a law, do people suddenly become supportive of marijuana legalization? And man, it's been hard to find matches for those.
Yeah. I think it is a very subtle way of designing, particularly when you combine survey with experimental design. And now, I think some students are particularly interested in the contrast of the pairs that you show in one of the slides. And can you talk more about the Republicans? Man, and that is the only pair you find it statistically different from zero. So how would you interpret it further? And some students want to, I think you in your last two slides talk about someone that may have better inference than someone really famous. And so can you go back to the coefficient plot and interpret that? This part. And
yeah, absolutely right. So I really kind of wish a benefit, by the way, of this approach is that all of these individual effects are built up from pairwise differences. So I could say, show me the effects among Republican men if I wanted to, but I didn't do that. I mean, of course, there's this issue of how many times you do that, and are you going to do statistical tests on them? But what do we see here? So this is the x-axis. This side is a little easier to interpret. So you either say 0 if you say I will not be vaccinated and I'm not vaccinated, or you say 1 if you say I have been vaccinated already, or I will definitely be vaccinated. Few people said they were already vaccinated at this point in time, but many said I will definitely be vaccinated. Okay, so this is the coefficient from regressing that binary variable, vaccinated or not, on the 5 category variable about friends, right? So are your friends and family highly likely to be vaccinated or not? 0 means not. So this is a move, a linear move. We're allowing kind of a linear relationship in terms of the outcome here. Of 1 point on the, from definitely not to probably will to maybe, etc., leads to a 10 percentage point difference.
Yeah.
Right, in the proportion of people saying I'm going to be vaccinated definitely. Okay, so it's a gigantic effect, because if we did this across the scale, it would be be way out there. Okay. So these are, it could have been clearer if we had coded this to be, do you perceive more family and friends than your pair mate? Right? Because then we would have 2, 0, 1 variables. Do you perceive more than your pair mate? And are you more likely to be vaccinated than your pair mate? And then that would have been just a cross tab. in some senses, right?
Yeah.
So that's like friends and family, neighbors, city, state. Now, we also asked everybody, how many Democrats do you think are going to be vaccinated? Do you think that they definitely, they almost all will be vaccinated? Let's see what the actual variable was. How many Republicans or Democrats do you believe will definitely get vaccinated? Okay. So, you know,
how many? That means just a number, or is it categories? Or
it's category like almost all. Let's see here, something
okay,
along
like
the lines.
Ordinal variable.
Yeah, I guess it's not here. Sorry, it's something like, you know, almost all of them will versus to all of them will not. Excuse me. So here we're restricting the comparisons among Democratic pairs, right? So we're saying among Democratic pairs, if we regress, are you vaccinated, or definitely going to be vaccinated on your perceptions of Democrats being vaccinated? We don't see large differences in proportions of people saying that they're going to be vaccinated. This is the effect of perceiving the Democrats among Republican pairs. Okay. Then we have these interesting Republicans among Republicans. So among Republican pairs, we did the same exact regression. We regressed, you know, are you vaccinated or are you definitely going to be vaccinated? Do you think that most Republicans will be vaccinated or all will, et cetera? And the more Republicans that Republicans thought would be vaccinated were related to a very strong, almost as big as family and friends, you know, estimate of a proportion change.
Did the width of the confidence intervals indicate anything?
Yes, absolutely. So, you know, this is using the full data set, and this is using only Democrats, and this is using only Republicans. And we threw away the independents, because we didn't know, are the Republicans the in group, are the Republicans the out group, Democrats the in group? We don't know you know, if they're the in group or the out group. And it also, you know, here we have tighter confidence intervals, right? You know, these are the same people, Democrats, and these are Republicans. So here the difference has to do with variability, right? So here basically, Democrats, just if there were differences between two Democrats and how they perceive the Republicans, it had zero relationship with their own intentions. Yeah, so this is an interesting, you know, piece in that, you know, it might have been easier to describe if we hadn't used like just these, like the linear relationships, conditional on pair. These are all conditional on pair.
All right, I think that this is so interesting. I have so many questions, but I do not want to push up the space here. May I have some questions from UTD, some US students of a general question, but before I relay that, let me ask on the Taiwan side, anyone has any questions, and from the design to the result to more general questions like applying experimental design or surveys and in policy relevant topics. And Peter, do you have any questions?
Yeah. Well, not as specific like yours, you know, in terms of the methods, but it's more about the design thing. So the question is about the result of the SMS study. Yeah, you hear me?
Yep.
Okay. The SMS study and the literature that you cited altogether seems inconsistent in terms of, you know, what we call the nudge strategy, right? We've been reading about using a text and try to promote the vaccination kind of thing. So or we can call it behavioral economics. Some of our students are interested in that, and you're an expert in that. So I think that's a general question. And as it has been gaining attention these days, so given the various confounding variables that you just mentioned, and what's your general advice on designing research? So in order to get a decent reliability and validity, do you think that matching method is the answer?
So I do think that, I think there's two answers. One is, if you can use the world to create differences, then I would use the world. Whether you can intervene in the world. So if you're working with the government in a behavioral economics lab, and the government is already gathering data on, flu vaccination or something like that, and they're already sending out postcards to them. If you can say, hey, you're already spending the money on the postcards, you're already spending the money on gathering outcomes, can I just randomize the messages on your postcards? Can I put a picture on your post? It's basically no cost to you. You don't have to pay for my time. That's a brilliant design, I think. Now, often you have very small effects because it's a postcard, but it can have it can teach you a lot, and it can also have tens of thousands of people can change their behavior. So the Office of Evaluation Sciences, which I'll find the link to, they have now done 100 of these sorts of studies. They're all randomized, okay? Now, and they all are of this nature, basically. Like this is the U.S. government's Behavioral Insights Lab. I don't know, when I was last in Taiwan, I don't recall if Taiwan had a Behavioral Insights Lab at that point in time yet or not. But anyway, this is the U.S. government's one. And so that's, I think, super strong. If you can't randomize, or maybe you don't want to, like in our case, although I'm a huge fan of randomized experiments and have done many, many of them, I don't know what it would mean if I were to randomize perceptions. I just don't feel like it's substantively meaningful to randomize there. Then you have to think, what can you do? Is there something in the world that's going to suddenly change how people think? Like suddenly they get cell phones and they can communicate with people whereas yesterday they couldn't. So they can learn about perceptions of others differently. Oh, interesting. Now we have a discontinuity, right? Or we have an instrument that suddenly changes people's perceptions. Electrification happens, or a hurricane happens, or something like that would be ideal. I mean, not a hurricane from the perspective of human suffering, but social scientists are often looking for these things. Finally, if you don't have that, rather than throw up your hands and say, I can't do anything, then I think matching is better than covariance adjustment with linear regression models. Because I think linear regression models, I use linear regression models to estimate things, but not for adjustment. Because it's such a burden to argue that I've done a good job for adjustment. But it's not my first choice. Matching isn't my first choice, really.
Not your first choice. Yeah, the real world that's here, right? Yeah. But that data is the first thing that you're gonna have.
Yeah, and in this case, we had the data, and it's a crisis, and we asked these questions, and we thought maybe we can do this, and we began by just playing around with the data, and then we realized, okay, look, we have to we have to get more serious here. We can't claim that there's a relationship when it's so easy to explain away just by saying, look, older people live here. Okay, I controlled for age. Yeah, but what age is probably non-linearly related? Oh, what about party? Is it interactive? And we began to have all these specification discussions theoretically, but we couldn't solve them because what really mattered wasn't theoretical specification, but was in our data. And so we said, look, let's just put this to the side. Let a computer produce these pairs.
Yeah. Thank you.
Sure.
Now, maybe I can invite students to ask any questions or general questions. And I have one student in here, Now we have a couple of questions. Let me have Tanyi. Tanyi has a couple of questions. Now, first question is, do you see COVID as a great opportunity / challenge for public administration scholars?
Yes, for sure. I mean, on the one hand, it's a human challenge for us all, right? Here we are, we're academics, we should be, serving and helping our communities. And so it's a call to action, right? I think climate is going to be like that too. When we start to see climate refugees, how will we handle social conflict when Urbana-Champaign in the middle of Illinois gets 100,000, a million people from Houston, Texas, and that's just within the United States. So I think that it's an opportunity for us to do good, but and now there's more and more people who are willing to randomize, and we also have data. We could have this meeting with these people who are mostly concerned about, look, these people are not getting vaccinated. This is going to be, our hospitals cannot take this. And we could say, well, we don't have the answers, but we know how to learn. Can we learn with you? And can we learn with you in a way? And they say, look, well, we don't want you to just publish papers. We want to actually save lives and not fill the hospitals. And we said, we do too, but we don't know the answers. So shall we learn some of the answers in the most rigorous way that we can? So it was a great opportunity. It's a challenge and an opportunity, I would say. And I think we're moving into a historical moment like that. I think you can't see, all the things going on around us without us feeling like we should be. We have more data, we have more possible partnerships. People are getting PhDs and master's degrees in social science and data science, and then going to work in governments. And those people want to work with academics and are ready to do it, or they'll do it on their own because they took classes. There's a lot of it's a great opportunity for sure.
Mm-hmm. Now, I have another student, Omar, and you said, did you consider occupation? Omar, are you there? Can you elaborate your question? I did not, because our question is brief.
Yeah, sure. It just had to do with the earlier question being asked by Peter, I think. Just for the, I guess, trying to figure out who would be the right people to ask these questions, who the target is. I don't want to use the word target because it sounds like marketing. Right. But knowing who to target, I guess age would be significantly more difficult than occupation, because occupation would imply a completely different social circle as well.
Mm-hmm. Yeah, we didn't ask people this. So this is one of these things where we wanted to do the sensitivity analysis, where we said, look, there's got to be things out there. I hadn't thought of occupation until you mentioned it. I was thinking about region of the country. We had some other stuff that we talked about. I'm going to write that down. But so we don't have it. And so then the question is, what do you do? So you say, well, occupation could be just, are people of certain occupations way more likely to perceive that others around them are being vaccinated? And are they also more likely to be vaccinated? Probably so, in fact. If you're a medical professional, if you work in a hospital, then of course people around you are being vaccinated, and of course you're being vaccinated. Now the question is how big is that relationship independent of age and party and gender, et cetera, enough to change the substance of our results? I'm not certain about that. Now, in terms of creating a field experiment, when you mentioned kind of targeting, like figuring out who to contact, I think that's a great idea. I mean, I guess it depends on which study. On the SMS study, that seems simple. Like, you can probably find people who are likely to be vaccinated to send them messages, and those people are the messages act to kind of remind people to prevent them from forgetting, for example. With the the social norm study, that's a little bit harder. I'd love to think more about that, but hopefully that's a reasonable answer to your question.
Yeah, thank you.
Sure, great.
It's a great question, Omar. And
Yep.
Peter, do you have questions from the Taiwan side?
You hear me? Okay. It's not directly related to your presentation today, but some students are interested to know about your lab and the more sharing about experience that you work with the government, because a lot of our students are they work in the government sector. So we're thinking about, well, the question is about how to do this collaboration thing, and share a little bit, share with us your experience about that.
For sure. So I've found a few different models. So I worked in, there it is, lab at DC. And so I worked in the federal government of the United States for 4 years, part-time. I'm always was teaching, students, etc. at the same time. And that model was kind of the one that I explained to you a little bit, which is that different government agencies want to know how to improve their work. And to the extent that what they're doing, that their work can be improved because of the behavior of people, then a group of social scientists and designers, it turns out, can be involved in that process effectively, right? So if you're trying to get people to fill out some kind of a form on time, or save for retirement, or do many other kinds of things, you can say, well, when does the government touch the person? In the moment that the government is comes into contact with the person and their decision making, is there something that we can change? Is there something that they're reading? Is there a human that they're interacting with? It, what's happening when they come in contact with the government? And what can we do to improve that process? Sometimes we would send, in fact, qualitative researchers to learn. So, for example, we had a vaccination project where friends of mine went and talked to nurses and doctors in Atlanta. And they said, well, what happens when somebody comes into your hospital? When do you talk about vaccinations? Does your health record tell you when they need a vaccination? Is it a burden to you to find out that they're due a vaccination? They talked all of that through, and then we designed a study of 1 or 2 or 3 changes here. And then the next question was, well, what outcomes are being measured by the government already? Because the US federal government can't do surveys, it turns out, or it's super difficult for them to do surveys. So we have to use existing data collections. Now, the policy lab at Brown is a different beast. It's based in Brown University. It's primarily it's doing a lot of work with the Rhode Island government. And so it can do surveys. The Rhode Island government funded the surveys that we ran, but it's a very similar kind of a relationship. They might say, hey, we're having trouble with something, or we think that you might add value. So you have to communicate what kind of value you might add, for example. The lab at DC is based in the municipal government. It's based inside of the government of Washington, DC. And they've spent a lot of time developing strong relationships with the police force. And for example, we're able to randomly assign police officers to wear body cameras. I think through all of these 3, I've only worked with the US government and the one in Brown, but friends of mine worked in the DC one. And one of my PhD students was offered a job there. One thing that they have in common is a commitment and transparency. So to work together with people in the government, you have to be trustworthy, and you have to not just care about publishing a paper saying getting a statistically significant result. You have to be very clear that you want to publish all results, null results, results that are politically unpopular, right? Like, you have to be the person that can do that. If you do that, then the chief of police will say, you're a trustworthy person. I'm willing to work with you. Or the chief of police will say, I don't want to work with you because you may not say what I want you to say. But that's a strategic interaction. You'll never know that, you know. So I do think that there's something in common that I've found across these different models. And these are only the three that I know best. There are certainly many different models by which academia can be involved. And I don't know the Taiwanese context. I don't know what's happening in Dallas. I know that Austin had a team of designers working there. They didn't have anybody doing statistics and evaluation, but they still had like professional designers coming and working there as well. So hopefully that's. Oh, the other thing is that I think that it's an amazing time. Like we're having PhD students from political science getting jobs, deciding that they love to run experiments. I have a student who loves to run experiments and observational studies and loves to travel to Africa and loves to do work in Africa. And the US government's development agency said, would you please do experiments and surveys and travel to Africa? And he said, I don't have to try to get tenure and publish a lot of papers. I can do social science without that hassle. And he said, great. And we've been seeing things like this begin to happen. You know, Facebook, of course, is hiring data savvy political scientists. And so there's like many more kind of options out there. My other student was was going to work with the police department. So when would you imagine the police department of Washington, D.C. would try to hire a political science PhD? Now, because they know they want research designs and data and things of this nature.
Great. And do I have enough time? Yeah, Carl, because that reminds me of some of your work that you organize or initiate, that social impact thing. Is that all right?
Yes.
It is called, as far as
research.
Research for impact.
Yeah, the causal influence, social impact.
Oh lab. Yeah, both. Yeah.
Yeah. So that kind of thing. It reminds me that actually Carl and I, we first we met and then we talked about this kind of thing, and you know your work is just a right fit for us, and so and also you're a policy guy, so you know whatever you're sharing here is really beneficial to our students, and both Carl and I also. So that's really great, and I want to say thank you for that. And so what do you think about that? So is that that motivates you to involve in all those initiative, you know, the social impact thing, right?
Yeah, it does. I feel like many people go into social science because they care about, you know, something about society that really motivates them in some way or another. I went in because I had lived in Chile during the dictatorship, and I saw people being, you know, hit by water hoses as they were protesting, and I thought, why is this happening? I don't understand. Why would you have a dictatorship? Why would you do this to people? So I had why questions, but the why questions came from kind of emotion. They came from kind of within me. And then, you know, at the same time, I always liked programming computers. And I somehow thought that there was that either you'd like to do the technical thing that was not political, or you'd like to do the political thing. Because I had friends who would go to protests and, you know, do protest things or go into politics. But I always had the why question, and I always thought that there was a kind of a tension between these two sides. But recently, the tension is going away. When I was a first PhD student, there was definitely a tension. I don't think that, you know, in the year 2000, the social scientists were welcomed. I mean, economists were welcomed and epidemiologists were welcome, but political scientists were not kind of part of the conversation, but now they are. And so it gives me a lot of joy, really, to be involved in these projects, for sure. And I think everybody, you know, you do your work because you have some kind of internal motivation, you know, like why you make your choices. Something gives you passion, you know.
I can see the passion in you. Thank you.
Thanks. Yes,
Carl?
that's true.
Mm-hmm.
Yeah. Now I have some more questions, if you do not mind, Ashley.
Sure.
I have a lot of questions myself. I'll let the student ask question first. Now, Tianyi is a question. Have you thought about any other methods in the behavior lab to evaluate marketing effectiveness? Tianyi, would like to elaborate your question? Yeah.
I would love to. Hi, Dr.
Bowers.
Bowers. Yes.
Dr. Bowers, sorry.
Hi.
I'm Dr. Ho's student from UT Dallas, US. Well, from an authoritarian context, I'm born and raised in mainland China. And I also have that passion you had. And I asked this question because I had heard one of the scholar, at least one of the scholar, she owns a lab in Plano, Texas, and do a similar study as you do, and testing the marketing material, government marketing material. So what I could learn from her is, say the similar text, and she can the procedure, and is that she puts the the texting material, the text on the screen, and she invited some people wear an EEG pad or a eye tracking stuff,
Neat.
very fancy, neat technology. They test the baseline and then give a stimulus. Like the survey taker or whoever, they call it a patient, okay?
Yeah.
To do the study and test the brain waves, the alpha wave, beta waves, and to tell whether he or she had certain response to a certain stimulus. That's how I think it's a very novel way to do the marketing effectiveness. I also think this. I also heard this from a Chinese scholar in the Shanghai University, and they do this more for the business perspective. So they have the like a advertisement. They do the A/B test. Like they show them one stimulus versus another one to see which one give more triggers more attention of the customer, a potential shopper. Right. I think that's very neat in terms of the evaluating the marketing effectiveness. But what I learned from your study, I think yours is really the beauty is that you kill kill two birds with one stone. Like you don't really get paid, require more financial resource from the government. You can just learning by doing, and it has added more value to the social society as a whole, as a general. I think it's brilliant. Thank you so much for your presentation. I'm really honored to be here.
Sure. Thanks for your questions. I mean, I do think that what we want to do is make sure that we're serving government, but we're also serving science as well. Like we want to learn. So and I think that serving government and serving or society directly, but also serving science works hand in hand, or you serve society in both ways because science serves society as well. It's very important to have a science that exists in this way that's kind of objective and outside of society in its own way, not exactly outside, of course, right? But academia is a very important kind of a social institution. So the idea of saying, look, we're going to publish all of our null results is, I think, really a big deal. It really helps science. In fact, now, so between the OES, which has done 100 of these studies, and the Behavioral Insights team in the UK, which actually has international group offices, there have been hundreds of these studies about communication and many null results, and some people are beginning to accumulate them. So there's a paper now where you can look across them all, and you can say, how, what are the results, what are the effect sizes like? Right? Rather than individual academics saying, "Oh, I can't publish this. Oh man," and then you don't and then you hide your null result. So it's kind of, I think, quite powerful idea that you have to be transparent in order to show that you're not being political, but by doing so, you speed science by having so many studies. And also, government is powerful. I mean, government can do. it's zero. It's so little money from the perspective of government to do any of these sorts of things. Whereas for us, it takes us years and years. Now, the question that you kind of indirectly raised about alternative outcomes, I think those are fabulous. And I would love to see more like lab style studies that are adjacent to the governmental studies. Like, well, for example, we have discussed within a government, there are many governmental forms. I don't know, in the United States, you're living, you're a foreign national living in Dallas, so you're very familiar with U.S. immigration forms, right? And they're, right? And so the question is, how can you improve them so that they don't put a burden on people, so that people don't make mistakes when they fill them out, and so that, there's less burden on the governmental bureaucracy. And so one idea would be we could have a lab in the government. What if we had a lab where every time you made a change to a form, you used the EEG brainwave, materials, right? And you learned about people's stress levels. You learned about, the relationship between stress and answering questions, right? So forms are high stress moments, especially immigration forms. And we don't really know much about the psychological processes of answering them. We know about survey response. There's lots of great studies of survey response, but there's very little on forms. And if you measured their skin conductance or their pupil, biometrics, you could do it. You could learn a lot. Now, right now, biometrics seem to be kind of lab based, but you could imagine saying, a suitable camera could pick up all sorts of things from your skin and your eyes, or the way you hold your head in terms of stress levels, or the tone of your voice. So I'd love to see more interesting biometric outcomes from any of these studies. And I think that we're just barely scratching the surface of them right now, because because we're moving out of the lab just very slowly, I think. But I can see them connecting. So really good question.
I appreciate it, Dr. Bowers.
Sure.
All right, allow me to take advantage, and if while we are waiting for more questions from Taiwan and also USI, and Peter and I actually have been talking about research for impact, and I sent the link of your art for impact art website to the audience, and if you're interested, you can click on that. And can you please also talk a little bit more? I think you answered Peter's question already, and I think occasionally, and sometimes I will receive a message from Art for Impact. Maybe you can introduce any opportunities. Maybe students from US and can participate. I know that there could be some other similar efforts, but Art for Impact probably is one of the first pioneer in this direction, and maybe we can learn a bit more from that initiative. I think it's still very active, right?
Yes.
Yeah.
Yes. So I think that the idea is that we can both accelerate science and do more good for society when we have these partnerships, right? Because even simply there's all these organizations who are already have budgets for contacting people to say we should save the planet or whatever, and but they haven't read the literature on behavior, and don't know how to evaluate, and even fewer of them have thought about how to evaluate the success of strategies that they're using, and so but academics don't have the money to contact 20,000 people with a survey, and so if you can create these kind of partnerships that are really authentic partnerships, then everybody benefits. With Research for Impact, the idea was to kind of broaden the possibilities for these kind of interactions. For some years, there's this other. Oh, look at that! Sorry, my light just turned off. There we go. Sorry. I think it thought that it was like time to turn off. It's like tonight I'm not drinking wine. I'm just drinking oolong tea from Taiwan, actually.
That's very nice.
Yes, this is mine. You know, you fill the thermos, you put the tea leaves in, you fill it with hot water, you drink the tea, and then you put more hot water. That's the strategy.
The problem is I have not visited Taiwan for 2 years. You make me really jealous of you.
Right. Well, I am very lucky because my in-laws I had not seen for 2 years, but they flew back from Taiwan in September, and so they brought tea, and I just had Thanksgiving at their house, so they gave me, you know, I am spoiled, exactly. The broadleaf tea and then the short leaf tea. So yes.
Oh, you know that. Oh, wow, you're an expert now.
Like you're one of the luckiest guy.
Yeah, exactly. Well, I'm very lucky to have, you know, like my coffee in the morning and my tea in the middle of the day and my wine in the afternoon. So maybe I'm just a heavily medicated guy or a guy who likes the good things in life, you know. So the idea is that, like, for years, small groups of academics have managed to do these kind of collaborations in different kind of contexts. Certainly, I'm sure that in Taiwan, there's a few people who have managed to have partnerships that are kind of built on themselves. They're just lucky people, or they're you know, they have you know good connections. They went to college with somebody and they are friends and could work together. That happens in the United States, happens everywhere. But we'd like to kind of accelerate this process. And so there's been a couple of organizations that were created. One is EGAP, which has members, 30 people come into a room and everybody reads a research design. Maybe 10 people are practitioners, not academics, and 20 are academics, and then we all talk about a research design. And that's, 30 people at a time. Very, 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 it takes a long time to accelerate, this process. So out of this, Adam Levine, who's the main actor behind Research for Impact now, and Don Green of Columbia University, and I. Don was one of the founders of research of EGAP, and Don himself has this long history of partnering with the League of Women Voters and different kind of voter organizations to do experiments. He kind of helped pioneer doing field experiments. We said there's got to be a way to accelerate this and make and allow more people who don't happen to just know the League of Women Voters or are in EGAP. And so we created this idea was just going to be a website. But what was amazing is that Adam had this great idea, which was, look, instead of saying to people that you should actually collaborate on a study, how about if you join Research for Impact, we ask you to have a conversation. That's all, maybe 30 minutes. And it turns out that conversation can be very useful on its own. So there are many, many organizations who have never spoken with an academic, who say things like, how do I reach people? How do I get more donations for my environmental movement? Or how do I get more people to vote or whatever? And Adam and a growing group of people that we're calling the matchmakers look through the list and say, hey, maybe you would like to talk to so-and-so. And then they contact the academic and say, hey, would you have a conversation with so-and-so? And the academic says, sure. And then a lot of the time, the conversation ends there. But out of the conversation, now this person says, oh, there's a literature on this, I didn't know. Or I didn't realize that I was going to do myth, fact. But myth fact turns out to be a really bad idea according to social psychology. That people believe the myth 2 weeks later. There's always these interesting kinds of research processes. So that's kind of what we've been doing now. So if you, and there's no reason it has to be based in the United States. I think it's an English language a community at this point. But anybody could do this kind of thing, just kind of have conversations between people in different sectors. in order to, and then maybe sometimes the conversations lead to more conversations and lead to projects, or maybe they don't. But sometimes the conversations just lead to, if you're getting the newsletters like Carl, you'll see they'll say looking for someone to work with me on Latino voter mobilization.
Yeah. Yes. Mm-hmm.
So sometimes someone will say, oh yeah, I know somebody. I'm, maybe not me, but a friend, right? So we're sort of activating networks to create these kind of connections, even if the connections are very kind of light. They're just like a conversation. So I think that's kind of what we're trying to do with Research for Impact, is kind of enable more people to have more of these cross-sector conversations, weak links kind of.
Mm-hmm. Mm-hmm. Yeah. All right, and I think I need to pass to the Taiwan side. Anyone interested? Actually, if you check out the website, I just posted EGAP as another resourceful hub. I think I call it a hub. Then there are a lot of stories, and also for myself, I have a lot of interest in this, and now we have a program called SDAR, and lots of my students are interested in doing data science for nonprofit and
Yes.
or government agencies, not necessarily in the industry. So this will be the area that really embodies and what I call data science for cause. And you have your cause, you have a passion, you have something to want to pursue. So this is the directions, and I think Dr. Bowers ran ahead of me and bring some, basically follow his path and bring some good examples. Now, Peter and I share some visions like that too. And
Great.
Now, any questions from Taiwan side? And I think I do not take too much time. Yeah, Peter.
That's okay, and we would love to leave the time to you and to ask your personal questions about all the matters that you're interested to know.
Yeah. All right.
By the way, I put a link in that ECAP is not only people who are doing these projects all around the world, but they also, I'm the methods director. So one thing we do is to try to help people learn how to do experiments. And we have a couple of things that we have done recently. One is we have these methods guides. So if you want to learn how to read a regression table, or more about adaptive experiments, you can see those links there. And then this year we published a textbook that helps people to teach classes on field experiments. So this is all, ECAP was born out of people who wanted to do experiments. I just gave a presentation where one experiment, one not experiment, and talked about the benefits of not experiments. But but in any case, the methods guides are kind of general, like what's a hypothesis test, that kind of thing. But the book is supposed to help people lead their own classes on field experiments. We've translated it into Spanish for use in Latin America, and we're translating it into French right now, and we'll be using it in Africa, French-speaking Africa, next summer. And would love to translate it into other languages as well. It's an open source textbook.
Well, it's like a project again on the list now. We will translate into Chinese, traditional, or simplified.
Oh, yeah, please. Absolutely. It's on GitHub, and we had so many interesting discussions, like how do you say potential outcomes in Spanish? I think it's a cool thing to be the translator, because it's kind of up to you. You'll be the people, everyone will use your words for.
Yeah, I have a few Spanish-speaking students in UDD. I think they should get a job and do that, and I think make add to their credentials and translation.
Yes,
I think Let me ask maybe one more question before
Sure.
letting you go, because otherwise I can take up the whole night to ask questions. Now, more general question, and you are doing some highly sophisticated and sometimes very complex research design and also results. And I constantly try to teach students how to communicate sophisticated design and sort of results to more like a layperson or more data science. You want something actionable. Yep. So you also talk about actionable items and even with the no results. So can you teach our students how to communicate very complicated and or sometimes the big data or different difficult methods to laypersons and translate it into actionable items, actionable things? Yeah.
I mean, I can't. That I wish that I could. I think there's sort of two points. One is the actionable. That depends on the partners. Like that depends on the people in the governmental agencies or the nonprofits or the societal actors who are going to kind of like pursue these ideas. You can provide ideas, but you don't. Most of you. I mean, maybe you're elected officials out there. I don't know, but I'm not an elected official, so I can't make laws or and I'm not the head of an agency. So you can provide things, but the question is, how do you communicate with people in those decision-making positions such that they feel empowered to make decisions? And one of the things that comes to my mind, and I haven't written on this, and I haven't thought. I mean, I've thought about it. I try to do it, but I haven't reflected about it very much. Is that I try to speak pretty simply. I try to really understand what I'm doing in as simple a way as possible for myself. And if I find myself using complicated words to explain to myself what I'm doing, usually there's a piece of it that I am not fully understanding. Like there's something about it that that I don't understand as well as I could, right? So, like, I also feel like you have to have it's a kind of a humility, maybe. Like I don't care if people think that I'm smart. So I'm not going to use fancy words in order for people to think that I'm smart. I could have said I used non-bipartite matching using fast integer programming, blah, 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 blah. But that's not the point of what I'm doing. The point of what I'm doing is to try to create pairs that are as similar as possible, right? And I've heard people often, there's a great book about writing by Howard Becker who talks about style. And he has a student who writes a paragraph, and it's a hard to understand paragraph. And he says, why don't you say it simply like this? And the student says, I could never do that. I wouldn't sound like a scientist if I wrote like that. I want to sound like a professor. Professors speak like this in its fancy way. And Becker says, well, you're confusing us with your speech right now. Why don't you just work on being clear, and then your ideas will speak for themselves. You don't have to use style to convey that you are worthy of attention, right? You can just focus on the substance. But it's a wonderful chapter because you realize that people have anxiety. There's a reason why people say, heteroscedasticity instead of non-constant variance or non-constant variability or something like this, right? There's a reason why. It's because of a feeling of uncertainty. So one thing I feel like I might encourage people is to focus really on substance as much as you can, and notice when it's style. It's hard to notice sometimes because you want to sound fancy. You want to sound like you're wearing a suit. You put on a suit, you're not wearing just a t-shirt, right? So you try to look nice and respectable. You want to sound nice and respectable. And you should, but there's a way of doing it that is kind of really focusing on substance and communication. when I was taking political philosophy, my friends and I had a game where we would try to use only short words. Because it was like we were kind of sick of the other students trying to make us feel bad by pretending that they were smarter than us in philosophy. And we thought, you know what, we can talk about the same ideas using short words. And it was kind of, it became a game among graduate students, but it was actually somewhat serious too. We kind of felt like we can talk about Nietzsche, we can talk about Foucault. We can communicate about all of this. But the downside is that you don't sound smart. And to kind of like give that up, is difficult, I think, especially if you're young and you're uncertain.
Actually, it's more difficult to convey that idea in simple words of short words like those. Yeah. And this is actually really, really gracious. Thank you for relaying the legacy of Becky. And this is I think really gracious thing to do, and continuing her legacy. And I think I need to show the movies to my students and let them thoroughly learn from you and get to know them, how the legacy is continuing. That's just a gracious thing. Thank you. Thank you. Gracious thing. All right. I think I cannot ask more questions. I think I used some of the quota. And Peter, do you have any questions for Professor Powers before we let him go?
Yeah, but instead of a question, it's more like a comment, though. Not personally, all right?
Yeah.
Just it reminds me of something, because recently I read about the recent edition of PAR, Public Administration Review, and the editorial by the Jeremy Hull. And then he talks about evidence-based everything, the end of it. Evidence-based everything. Basically, it's about, we've been talking about evidence-based policy for a long time. And however, this pandemic for the past years, it seems to, well, from his points, it's kind of, I know, it rings the kind of wake-up call to the academia, because what kind of science are you talking about? What kind of evidence are you talking about, right? Evidence-based everything, and however, still value-laden or politics-laden. So, right, you can use that to support your subjective position and your value. So it's kind of reminding us that kind of the science or evidence you're talking about. So that kind of respond to your comment about the collaboration between the academia and the practitioners, right? There's a balance in between, right? Because different experience. You thought about that, and so this is a comment. If you want to respond back to me, and I appreciate, always we have to be honest that we have our ethics to speak the truth.
Yes.
But however, the truth sometimes hurts, and so that's evidence, right? And how do you hold on to your position in that kind of situation?
Well, I agree, and I do think that, like, I have a couple of points. One is I'm going to put a link to one of my favorite papers, which is about basically kind of critiques. It's written by somebody who critiques evidence-based medicine, and about how randomized trials can be an argument from authority instead of an argument from evidence. And it's a fabulous paper about that problem. Like, on the one hand, randomization is amazing and it does what it exactly is supposed to do. But on the other hand, merely randomizing in the absence of a scientific theory doesn't really teach us as much as we'd like. There's also value theories about the way you think things should work, and it's hard to escape those. I think that the teams that I've worked with haven't been luckily have not had to confront projects that go against their values. we had discussions along those lines about, knowing that we as a team have some shared values as academics, that might lead us to have certain preconceptions about certain kind of projects we might be asked to pursue. But I think that another benefit of being an academic is the ability to say no. Is that you could say, I'm not going to do that project. Luckily, because my food doesn't depend on it, I can go back to teaching. But that's kind of a weak answer, really, So I think the values problem it's a real thing. And I don't think it's really, maybe it's not a problem, it's just a fact of life. We will have different values, and politics is about values and about unanswerable questions. So kind of just knowing that that's the space you're operating in is probably at the very, like a minimal condition for doing this kind of work. And then, this question of evidence-based everything, doesn't, so what? I haven't read this, but I strongly suspect it's kind of a critique of the idea. And I can definitely see the critique. I don't know if this Mita Giacomini paper addresses it, but the idea that you should have some theory about why things work seems reasonable to me as well. One thing I might note is that in Research for Impact, a lot of organizations are explicitly ideological, and they say things like, I don't want to talk to somebody who doesn't believe in climate change, for example, or or if you ask me to talk with somebody, how do I know that they're ideologically trustworthy? I don't want to spill our secrets and have the Democrats learn the Republican secrets or whatever. And I have not been engaged with that side of things. And I think Adam has been better able to say, okay, I'll find somebody who might suit you more, but who still has the academic values of transparency, publishing everything, contributing to science. And so you sort of hope that if everything is in the open, at least you don't have, policy-based, evidence-based policy-based evidence, essentially evidence that's just fabricated to justify some kind of previously held position, right? At the very least, you don't have that. But it's a great question. Thanks, Peter.
Thank you. All right.
Yeah.
It's about time, right? 2 minutes.
Yeah, great answers too. Great. Yeah, I think it's never enough. No, but anyways, we must let Dr. Bowers go. And before wrapping up, I want to advertise again our next event, and we will have another scholar, Jeff Gill, will come to us. That will be December the 7th, a little bit different, and date. I'm sharing the content here, sharing the page. Can you see the page? And he is talking about political science and data science. And Dr. Jeff Gill, it will be December 7th and December 8th in Taiwan. And please join us and check our website and register. And all events are free, and also the materials will be up on the website, and including Dr. Bowers' video. And I will share his slides, and it's very generous and sharing everything. And I think I will get, I got a transcription too. Everything will be uploaded. And I think advertisement time is done. Peter, would you like to give a concluding remark?
Yeah, I just want to thank everyone from the Taiwan side and the United States side, especially for Jake. Thank you very much for sharing with your studies, especially for all the ideas that you had from the previous work and your value, of course. And then I appreciate that very much. So I just want to say thank you and stay tuned. Please do come back for the audience, and please do come back next week. And we're expecting to see you all again. Thank you very much. Thank you.
Thanks, everybody.
All right. Thank you again, Jake. Thank you.
Thank you. Yeah. Good night.